colleagues, administration, Dr. Lynch, esteemed executives, good afternoon and welcome to our presentation. We are Team 5. My name is Max Gituba. This is Adi. We are presenting today, and our solution is entitled Pfizer Reg Intel Copilot, which is an early warning system for regulatory compliance. Now, let me start with a story about leaks. Have any of you had a leaky faucet in your house? You don't even think about it. It seems like a minuscule problem. What you don't know is every single year, you could lose up to 3,000 gallons of water, enough to fill a small pool just from that one leaky faucet. So the lesson of this story is that small leaks create big losses. So you are an operating executive at Pfizer. You go to your board of directors and you're telling them, okay, I can save you $150 million in 2 years. Do you think they'd be interested in that? Right? What if you sweeten the deal? Say that you could quadruple that to $600 million per year by year 5. What if you sweetened it even further and said that you could double that to $1.3 billion per year by year 10? I think that sounds like a pretty sweet deal, right? So, this is not magic. It is the science of artificial intelligence and LLM technology. Now, we did an analysis as a team looking at AI-enabled versus non-AI-enabled firms within the space, especially in regards to operations, and we found very interesting insights when we looked at BMS, which has been very vocal about using AI in their operations versus Pfizer, which has not over the last few years. So as you can see, AI-enabled firms like BMS have higher and more consistent revenue per employee, as well as higher and more consistent and stable operating margins over the last few years than Pfizer, which is a little bit more inconsistent. So the lesson of this is that AI-enabled companies have higher operating efficiency.
Alright, so I want you all to meet Samantha Smith. So who is she, what does she do? Let's dive into that. So she is the head of global regulatory affairs. So what's her job? Let's try to understand what she does. So she oversees thousands of regulatory and compliance documents. Let's see what problems she faces, what pain points does she have. So she faces the problem of delayed risk detection, manual oversight overload. So manually going through thousands of regulatory compliance documents. Geez, that's a lot. Wasted spend on rework and delays. So what does this cost the company? This costs the company about $600 million per year in opportunity cost. So I introduce you the proposed solution and our copilot, the Pfizer Reg Copilot. So what does it do? This is a copilot. It flags risky items, it smartly prioritizes it, and it gives you explainable alerts. So I'll walk you through our prototype right here. So this is the dashboard, as you can see. It has all the flagged items, low risk, DB needed, and high risk items. So you just go and upload your document. So you go browse through the files and select which document you need to upload. And then you select which department the document is from so that it's easy to trace back to. So it's from general medicine, then you select the date of the meeting or when it was conducted. And you name the project, obviously. And so it was project X. And then you select the region of where your company is based at. So this was of Europe. So you just do Europe and you hit upload and analyze. So what this does is, so as you can see, the analysis completes. The copilot has completely analyzed the entire document. And you can see it gives you the flagged contents, regulatory concerns. And you can comment down below so that your team members know. That you can also mark it as reviewed, or you need to assign it to some department, or for analysis, you can do that as well. So, how does this help Samantha Smith? So after using this copilot, what benefits does she gain? She has easy regulatory access, she has automated reviewing of company logs, and most important is prevents late stage corrections. So before the company can deploy certain resources, the copilot sort of tells them whether or not they should do it or not. What is the benefit to the company? Well, $600 million per year in SG&A cost savings.
So let's talk about return on investment. I know this is our favorite So now let's look at what SG&A forms as a percentage of revenue. It forms 23% of Pfizer's total revenue. You can see that 7% of that number of the total revenue is compliance-related work, and we estimate that with our solution that we can reduce that number by 30%, which sounds like a small number in hindsight, but if you look at Pfizer, which is a company that is so big with billions and tens of billions in revenue, it actually translates to over $600 million per year saving. And if you look at that number, how we calculated it, we already said the 7% and 30%, but we applied a 50% realization rate because we acknowledge that we can't realistically cover all the entire cost at once, but we do believe that in 10 years given time, we can actually double the productivity of our product and reach that $1.3 billion mark. That sounds pretty sweet to me. Now, Pfizer cost saving projections over the next 10 years. This is just a projection of what that would look like. It looks like an exponential curve. You can see in year 2 we have 150 million saving, 600 million by year 5, and by year 10 we have that sweet $1.3 billion. Right? All right.
So obviously it's an AI co-pilot, so ethics and compliance play a huge role and an important role. So the AI is fully transparent and it enables traceability, so you can go back to the minutes of your meeting or your logbook or your reports. It ensures complete data privacy and confidentiality. There's consistency and bias control, and all the document reviews is audit ready, so it saves you a lot of time as well. And it establishes clear role boundaries. So what we have done is we have always ensured that a human in the loop, so only a human can sort of authorize the co-pilot, and only then the things can go further.
So our ask is $20 million for the development cost and a $4 million annual maintenance and support cost. And we believe that with that amount of money, we can get to that sweet $668 million SG&A reduction within 5 years. Thank you very much.
Executives, questions, comments for the team? Please, the full team, assemble in the front.
Super tough job, guys. Really great job. So compliance is actually something that I deal with a lot with workforce training and with our software. I think you might be underestimating the cost savings for something like this because I'm not sure. One of the things that I'll just tell you kind of what we did. We looked at not only what our solution would directly save, but also the kind of the multiplication of lawyer fees and turnover and all of the other things that non-compliance leads to. So you might be able to get that up there.
Make it sweeter.
I was going to share a similar thought too to Kristen, which is like it's such a big number, and one of the things that investors are really responding to is what feels real in application and letting employees play to the top of their salary. You hear that a lot in pharma now because there is a talent war, super talented people, they want to do less of the manual effort, while also understanding that there's a desire to ensure your job isn't being replaced. So I think if you can break down what's going into that savings, right? Kristen gets to do more of XYZ that goes back into the business, or get through more compliance activities in a given amount of time. Like that's really compelling and can help explain that big number. But great work, and definitely an area that's a lot of executives are looking at investing in and doing more here. So.
Yeah, no, it's good. I mean, I have one or two thoughts that come to mind for me. One is when we spoke on Monday, I think like some of the things were about clarity of idea and a clear ROI, and like you landed both of them really well, right? So I just wanted to acknowledge that. And then yes, I think I give very similar feedback that like compliance is a very diverse topic, and I'm not sure you're going to hit on every value pool right away. But if you can break that down a little bit, like how that becomes bigger, I think that becomes like a really interesting story. And then the other thought is, and I know we were sort of, you were getting my attention, right, when you're showing BMS and Pfizer and all these sort of things. Equally thought-provoking would be an industry benchmark outside of Pfizer, outside of life sciences, because I'm sure that we can learn a lot, and you'd be surprised how much people will act when they think another highly regulated industry, aviation, is doing something smarter than we are. So that would just be another bit that really, you've got me writing down ideas for week 1 when I'm back next year. I think a really nice idea. Well done.
You're welcome.